Good morning, good afternoon, everybody. Welcome to our digital seminar on the future of digital learning. This event is a partnership event between the University of London Institute in Paris, the Centre for Distance Education, and Goldsmiths, University of London. We ran our first event back in June during lockdown as a response to some of the events that were happening in the world and the evolution of higher education to take account of the pandemic. We realized at that time that there was a lot of interest in all of the topics that we proposed, and we decided to set up a monthly series to accompany people working out in the field in higher education that would start with this event today. So we're going to be carrying on into the future with these events, and the idea is really to set up a discussion forum for all of you out there, but also to let you hear from the experts and practitioners in the field across a wide range of expertise and areas of competence in digital education. So I'm now going to introduce your chair for this afternoon or this morning, depending where you are. Dr. Linda Amrane-Cooper is the head of the Centre for Distance Education, and she's going to introduce you to today's session. I hope you enjoy it. Bye-bye, everyone.
Hello, and a very warm welcome. Thanks, Tim. So I'm Linda Amrane-Cooper, and I head up the Centre for Distance Education at the University of London. In this series of webinars, we're going to be exploring experiences in digital learning. I think it's a very apt title for the series because there can be no doubt that the impact of the pandemic is leading to significant shifts in how we work with our students. The learning then is both about the ways in which our students are being engaged in learning, but also about the ways in which we are adapting and improving and innovating and are therefore learning ourselves. Across the globe, those involved in higher education are responding to remarkable volatility in environments, with the economic and health impacts of the pandemic creeping very seriously into every aspect of our professional and personal lives. We are constantly adjusting our teaching, flexing to meet restrictions and to ensure the very best for our students. That's why I'm so excited to start this very first event, exploring experiences in digital learning, with picking up on the theme that follows from that volatility, managing volatility through learning design for flexibility and contingency. It's easy to become depressed in the environment that we face, but what I find with my colleagues, and I hope it will come across today, is how incredibly creative and innovative people are at this time, and how rich the learning experience that we as colleagues who are providing education to our students and our students are contributing to a really vibrant development. So I'm absolutely delighted to introduce you to our three presenters. We have Matt Dane-Baker, who will be starting. He's Senior Vice Provost for Academic Affairs at Thomas and Jefferson University. And then two colleagues who are closer to me in London and both of whom I work with quite regularly, Daksha Patel, who's Assistant Professor of International Eye Health at the London School of Hygiene and Tropical Medicine, and Sally Parsley, who's Professional Services Digital Education Manager, also working in the eye health area at London School of Hygiene and Tropical Medicine. So we'll have two presentations, Matt and then Sally and Daksha working together. Then we'll have an opportunity for Q&A, and we hope to be able to really encourage a rich dialogue. Just to say, as I'm sure you're very experienced now with these things, you have the ability to input questions on the question panel, and we would very much invite you to input questions there, and I'll be picking those up and sharing them with the panel in the Q&A session. Thank you very much. So Matt, rather, if I may turn to you, please. You're live now, Matt, if you're able to respond.
Yes. Hello, yes. Next slide. Okay. Here's someplace. Well, thank you very much for having me. Just a little bit about in context here. So Thomas Jefferson University has, it's a university and a 14 hospital system. We have about 10,000 learners, 8,500 of those are traditional graduate and undergraduate students. And then we have a whole residents and fellows and postdocs. And in March, of the spring, we were actually mandated to go totally online. And then we were allowed to reopen, but had to submit to the City of Philadelphia government our plan for reopening. And I'm going to put some of that into context. So a lot of our learners, we have probably 80 different health programs, and we have 40 different architecture design programs. So we are very much based in the professions, and that actually, actually created some of our ability, the decisions that we made, and I'll sort of try to walk through these. We are one of 30 universities in Philadelphia proper. There are 90 universities in the 5-county region around us. And out of the 30 universities, people got to create different plans, and we are only 3 that are still doing in-person teaching. But when I say that, I should point out that 70% of what we're doing is online or virtual. But we felt like we still had to maintain, for a variety of reasons that I'll talk about, some of the in-person learning, and we'll talk about why we chose the model that we chose. Next slide. So factors that we considered when we created our plan for the city, and when we created our instructional delivery methods as far as each of our 10 colleges, the first things we had in mind were the safety of the students and faculty. And to that extent, what our recommendation was that if you can do things virtually, please do them virtually. We also had to have the optimal pedagogy that matched the content and the learning outcomes that we were trying to provide. So if it was our 1,400 student nursing program and they had to be on clinicals and a pediatric rotation, that was very, very hard to accomplish virtually before, and did not meet the accreditation guidelines. So if we couldn't do that, our students, it would negatively affect the ability of our students to progress to graduation in compliance with some of the specialty. We have 31 different specialty accreditors, from our business school to our architecture, engineering, and then all of our health programs. So what the first thing we did is we talked to the deans of the colleges and the department chairs, and we tried to define what were the essentials, like what thing did we have to absolutely provide in person for each program. And what we got back was very detailed information, but not surprising. Most of the clinicals, rotations, and that we do, some labs, studios, and simulations could be done virtually very effectively, but some that involved very specialized equipment, scanning electron microscopes, high fidelity simulator robots, a variety of things really had to be done. Some research experiences had to be done in person, and we needed to do that safely. We also considered the audience, the type of students, the learners. We realized from experience that graduate students and older adult students seem to have adapted to the online environment in a very, very different way than freshmen coming out of high school, and students with special learning needs who have specialized learning plans. Student engagement was always important. No matter what mode we used, student engagement was very, very important. And so we encouraged faculty to use synchronous modalities or asynchronous modalities that that just promoted student engagement. Next slide. So we searched around for a variety of methods. We had been using online, in-person, and hybrid for years, hybrid being where individual cases have face-to-face learning and online learning that are combined. And we chose the high flex model. And here's EDUCAUSE's my favorite definition of high flex. It's a hybrid, flexible, or high flex course format of instructional approach that combines face-to-face and online learning. And this is the important part. I think each class session, each learning activity is offered in person, synchronously online, and asynchronously online. And the reason we had to go with and pick with this model essentially had to do with the unpredictability and the dynamic. We monitor every single day at 7 a.m. the number of people that go into quarantine isolation and become positive with COVID-19. And those people have to leave class, and some of them are instructors and some of them are students, but they have to leave class for either 10 or 14 days and are followed by the Department of Public Health. And so we had to make a schedule that was flexible enough that a person could be in class, but then have to go online and still not miss anything and be able to progress to graduation. So that's why we chose the high flex model. Next slide. So there had to be optimal alignment of the actual learning outcomes for all of these programs, what we wanted our students to do with the pedagogy we were going to use and the instructional design and the instructional methods we were going to use, with the technology that we had, with faculty training to be able to use that technology. And so that was that was our summer project. And we have 15 instructional designers working on this, but there was amazing amount of faculty involvement in this. Next slide. So I'm going to move into before I sum up what lessons we learned, I'm going to certainly move into at least some examples of what we were able to do through some creativity and through a lot of collaboration with people across the world. So architecture traditionally involves these large studios that could have 40 to 60 people into one studio room with two architects walking around and looking at student work in the studio environment. So all of classes like architectural history and things like that were all put virtually. But for the architecture studios, this is sort of the methods that we came up with. We had a lot of barriers. You can see the professor at Garstach is sitting with a mask and a headset, and he is sitting in a very separate room so he can see people through plexiglass. And then the students were they were de-densified. So a studio that would have 40 people in it now had 10 people, and they needed to be 6 feet apart, but we had people like 10 to 15 feet apart, as you can see. We had a lot of virtual studios that we could do online when they didn't involve 3D printers and other things that they needed to do in person. And we also involved some technology using Wacom tablets, where during critiques, a professor would walk around, and traditionally they would put a piece of paper on top of your CAD drawing, and then the professor would draw on that, but they have to be fairly close to the student for that. And we found a way to do that through tablet technology and a way to draw on student CAD drawings where the professor could critique them and the other professional architect critiques could critique them. Found that very useful. And it kept students safe, but still was able to create the learning outcomes we were looking for. Next slide. a variety of design programs, from fashion design to graphic design to web design to industrial design. And these are very, very different courses, and we had to use very different technology. And you'll see some of them here. We also have some engineering lab things here. So for drawing, where the professor felt that he had to actually see things and the tablets wouldn't work very well, we moved it outside. Now, when it gets cold, you'll see the tent there. When it gets cold, that's going to be a little bit more complicated, but we have a workaround for it. But you can see we use the outside lines. You can see for things like fashion design that we certainly decreased the number of students. So there were only a few in each. They were able to do some virtual things, but when they needed to use sewing machines and other equipment, they were in a very, de-densified environment. A lot of use, as you can see, of plexiglass. We certainly improved the plexiglass market during the period of time, and we separated people out to make sure that people could see each other, they were engaged with each other socially. And a lot of live technologies. We use Zoom and Blackboard Collaborate, but there's a lot of, and then there's a lot of CAD things that people can share, computer assisted design where people can share. We found that these are going very, very well as of now. The middle one is an engineering lab, where in electrical engineering, they had to do a project on circuits, and we had to send students kits at home. So, and then they were able to do this live with an instructor. Next slide. So this is our simulation. We have 5 simulation centers, but the biggest one is our 65,000 square foot simulation center, and students would have to be fairly close to each other. So we created a very different environment for this. Does everything from physical exams to to standardized patients, which are actually live people that they can interact with that don't have the diseases, and most of those are elderly, and we didn't want to bring them into the center. So we came up with a variety of different methods. The first one was drop and go, which is, you'll see that there's a box with a little head in it, and that's sort of for airway management. And students got to pick up their box, and then they went home, and then there was training videos followed by them doing, say, an intubation while a physician watched them do it and critiqued that. So the drop and go worked very well for learning ultrasound, which they would have to learn in the lab. We bought butterfly ultrasound probes. You can see one that goes on their iPhone, and they can actually practice on close friends and family members and their cat. And so that worked quite well. And we have live skills assessment that you can see the professor using with a checklist next to them where they're doing it live. So we were able, and all standardized patients are done via Zoom. So we were able to do about 60% of simulation for all of our learners, and those would be resident fellow physicians, medical students, physician assistant students, nursing students, midwifery students. We're able to do most of it online, but when we had to do in person, we did some, and those people had complete PPE. Next slide. So this shows some of our laboratories, and we certainly in the science and the health areas. For our interprofessional education, we switched to totally online Zoom, or the use of you can see it's on Second Life, where interprofessional groups of doctors and nurses and techs and get to interact with each other in Second Life in a virtual environment. That's going pretty well, I think, and we've been happy with the results of that. You can see the nursing college had to be in person, so they're wearing full PPE. You see them in the right. A lot more depression and anxiety than we thought. So we have a service dog, and there's Maggie. She's right there helping students with their stress levels. and we did a lot of the one on the bottom left is a simulation in from very sophisticated software and physiology. These are action potentials that we did the lab online. So a lot of success in that, a lot of success with case-based occupational therapy. Instead of bringing people in for low vision where people would wear goggles, people just looked through a Ziploc bag and tried to read their medicine bottles, and it could simulate low vision, and we wouldn't have to do it in the lab. Last slide. Oh, look, one more slide. This is a supply chain. This is a business simulation done with GIS. And we were able to get the software and Zoom together so that students could share their case problem-based learning. Next. And this is the last slide. This first one I think is fairly obvious. Lecture and small group learning was much easier to pivot to virtual environment than some of the hands-on experiential learning. And I think you get a feel for what we were able to do in those environments also. Everyone's talked about the digital, or some people call it the bandwidth divide. And it is real. And we were able to solve that for faculty by having them teach by themselves at the university. But for students, we had to, how to use things like, the Wi-Fi hotspots off of their phone, nodes, mesh nodes in their houses. And so and loaner laptops. We're getting better at this, but it's not perfect. Student expectations, engagements, distraction, isolation, an increase in the number of mental health visits and a doubling in the number of counseling and tutoring visits. We don't see that as a bad thing, even though there's a lot of literature now. One study came out with an increase in suicidal ideation, but a decrease in the number of people reaching out for help. People are reaching out for help. We've had a lot of special learner issues with people that have certain learning disabilities that we've been able to adapt to, some faculty concerns, and we were able to be flexible enough to have faculty be able to shift to all online, and when we needed to do that. We've been using 2 or 3 early warning systems. One's called Starfish, where we could send alerts to students and their advisors when they were having problems, or if we didn't see a student in class for they missed a quiz. And in the future, don't have a lot of time to talk about this, but just to say that much of the technology you saw in these slides, much of what our investment has been in faculty training and in technology and instructional designers, we think has paid off. And we are definitely right now looking at when things come back to normal after the vaccine, this will probably continue about at least 30% of these endeavors we're doing. Thank you. Matt,
thank you very much. Absolutely fascinating. And so, as I said, innovation and creativity at really very, very high levels. I know there will be lots of questions and the audience will want to probe on much of what you said, but I'm going to move on to Sally and Daksha now, if I might invite them to do their presentation, and then we'll pick up on questions and answers after that. Thanks very much, Matt.
Thank you, Linda, for this opportunity. I think if we go to the first slide, please. So we're going to work together. Sally Parsley and I are colleagues at the International Centre for Eye Health at the London School of Hygiene and Tropical Medicine. And our institution is a postgraduate training institution, much smaller than what Matt has described, what he's doing. And within that institution, we belong to an even smaller unit called the International Centre for Eye Health. Within this unit, we are challenged to do education and research, specifically with a mission to eliminate avoidable blindness globally using public health strategies. So we are a very niche subject in even within the London School of Hygiene and Tropical Medicine. Next slide, please. So like most places, on the 2nd of April, we received an email from our newly formed Education Contingency Committee. And that committee said, well, all the education had to go online. And at that time and moment, it didn't seem like it was a dramatic thing to do, because most of our students who were there had primarily finished their teaching components and were at the point where they were going to do their exams and go and do their own research projects. But by the 6th of June, we received another email from the same committee saying, actually, the next academic year, starting with the first term, we're going to go online. And this suddenly meant we were primarily delivering a master's, which is face-to-face, had to go online. And immediately the thoughts about all the things that needed to be put into that equation came to the forefront. And naturally, quality of the content that we were going to put online, quality of the support we were able to bring in place, quality of the experience of learning from experts, which we had embedded within our face-to-face sessions, had to now go online. Next slide, please. So this kind of made us think that we had a long pathway to create. We immediately realized that that pathway was very much within a sort of a restricted framework, in a sense. We had the tight curriculum time frame. So we knew that we had the 1 year within which, or in fact, the first term within which we had to do an X number of things. We were also governed by what we call the credit framework, which meant that the credits that we were assigning to our modules were equating to a certain amount of hours of learning. How are we going to balance that? We certainly had good educational content and resources, but much of this was driven by a wide range of experts that were dispersed globally. And bringing that content together was another big challenge for us. And assessment by all measures then looked rather small in the challenge, and we were more able to be flexible on that one. But alongside these rigid components, we also had to think about what it meant for copyrights and permissions from all these experts. What did it mean for synchronous, asynchronous? What were the different digital skills our students were coming with to this particular online learning? And what were the accessibility issues and the support that would be required? Next slide, please. So we very boldly put some thoughts together and what we might have to transition from what we were doing in person to what might be needed online. And we realized that at every level, we needed to bring about some clear changes in our practice. And that meant that we had to take a wholesome look at what we were doing. Next slide, please. So the first thing we did was we formed a team. And this team was made up with the core academic team that knew the content well and was led by myself and the module organizers who were in charge of the specific modules. And then we teamed up with the learning technology management system, which Sally led from within our team, and we pulled together in a very clear construct as to what we had to do from a learning design, a content production, and how to do a quality assurance check on it. But alongside that, we're part of a much bigger organization. And that meant that we also needed to tap into all the things that were relevant from the wider LSHTM teams that were working there. And so we created a clear network within which to work together and work towards this goal of digitizing the first term. Next slide, please. So there we found ourselves. We were certainly trying to create something that was going to allow for flexible learning, but in a rigid construct. in trying to bridge that transactional distance that we had between us and our students. And within that, we were very conscious that the mix that we have of our students are right across the time zones around the world. And that in itself lends a lot of difficulties in how we bridge that transactional distance in this rigid structure. We had a very clear wish list in how we wanted to do things based on the different frameworks we had. And the first thing we wanted was a clear linear sequence on how the students would be able to gain their knowledge as they went along the modules and the content that we had. We had to create a lot of content to start with and certainly embed within it formative and summative learning pathways too. What is central to our postgraduate learning process is reflection and active learning. Most of our students are already graduate doctors, and they are here to be taking on postgraduate studies. They come with a wealth of experience, and we are building on those experiences from what we share with them. And therefore, the format in which we bring about that reflective learning was very, very important. And where do we embed that within our mix was very, very important. And then the rigidity to everything came in was, how did the modules connect with each other? How did the content connect with each other? Where do the time frames sit in the whole picture of what was described as the term one, so that we could still fulfill the requirements of the credits? So this was our overview of where we found ourselves. And what I'm going to do is hand over to Sally, who's actually going to talk you through how we then implemented our wish list. Sally.
Thank you, Daksha. That was a great overview of where we had got to sort of by, I guess, early June, wasn't it? Next slide, please, Eric. Oh, next slide again. I think we might be going backwards. Great. So where I come in is where we, as Daksha said, we're starting to take this wish list, these requirements that we have from the school, what we know about our learners, what their needs are, and also what our faculty and our group wants from this digitization process. So this slide here is kind of a summary of what Daksha said already, but we're turning it into a list of requirements, turning it into that practical process-based approach to create and deliver our solution. So just to pick up on some examples, we know, as Daksha said, our learners are across a really wide time zone spread. I mean, we know they have a variety of digital capabilities and connections. The school has set requirements for what a postgraduate module looks like. We knew we had to follow this teaching for 6 to 8 hours a day, 2 days a week for 3 to 4 weeks. And from our own personal group, for example, we knew that we were going to, faculty don't all work full time, so we needed to be flexible with when the faculty were available. And we also know, and we also have a plan to develop our online learning. And this is a pre-COVID plan where we want to move to teaching more at scale with a more flexible learner pathway using a postgraduate certificate diploma into the masters. So could we design and digitize these modules to save us time and effort and maintain quality with moving to future learning? So next slide, please. So we've got our list of requirements, and then the approach we use is to design the course is learner pathway mapping. So we do this is based on the work of Open University, UCL, ABC and many others. So what we do is we map how the learner engages with the activities through each day. And we use a software called Miro. It's a collaborative whiteboard software. It's a for-profit app, but it wasn't terribly expensive when I got our account. It's about 50 quid a year. So if you can launch the demo now, please. That's kind of what our board looks like, but I'm going to talk it through in a little bit more detail. So one of our feedbacks from working with faculty is that they're not terribly intuitive when you begin the boards. But there we go. So if we can zoom in on that first board, Eric, please. Thank you very much. This is great to have you running it. So we have to teach for a day's activities. So, and I have to say, Daksha and I had a little bit of very interesting discussion about what was the best way to set these boards up to work with the module organisers and faculty. So it was very flexible. And I've put the little pink circles with numbers in so I can talk you through it. So number 1 is the day. We knew we had to teach by day. Number 2 is we knew we had to teach in this sort of block of 6 to 8 hours, remembering always that we have a student in America who's getting up very early and a students in Hong Kong who are starting later in the day. Number 3 is we know our intended learning outcomes, and so they are listed out on the board as well. And then at top number 4, you'll see the different kinds of learning activity. As Daksha was saying, we're trying to promote this flexible and active learning that's relevant to our learner's professional experience. So on the left, the white column is a bit small, but it's the more assimilative kinds of learning: read, watch, listen. The 4 coloured blocks are more active kinds of learning: creating, investigating, group work and discussion, and practice and self-assessment in red. And then on the right-hand side, there's a final white vertical column, and that's a real practical design column for designers and creators. And that is to help the faculty, as we design the course, think about how we're going to communicate with the students through the day. And then number 5 is the space where we're going to map out the learner pathway through the activities for the day. So if you scroll along to number 2, Eric, please. So this just shows you the very first activity we put into our very first board. The way we worked was we'd have a sort of hour-long Zoom session, and we'd bring in the module organizer and maybe some contributing faculty who might be taking a teaching session or helping to write some of the content. And we would talk through what we had already and how we were going to break that down into flexible learning that would suit this largely asynchronous delivery with some synchronous delivery in the middle to bring everyone together and keep us on that rolling rhythm that we, as we would have had in the face-to-face. So if you zoom again, scroll along again, please, Eric. So if you can zoom in a bit more, that would be great. Thank you. So I just wanted to show you can see how the different activities map against a particular learning outcome. In this case, it's a key concept is understanding what prevalence is of a disease. So we have a video, then a few steps later we have a quiz where we ask them to reflect. And then we bring everyone together for our lunchtime session, which we have every day. And we have a group discussion on the use and misuse of prevalence in studies. And the other thing I wanted to show you is that little box of activities at the bottom. So what we found is when we got going with this approach was that our activities were crossing across our channels, our silos. So we just started to put a box around them and gather them up together. So this example, we start by asking the students to go to Medline and do a quick search for some studies on prevalence of blindness in their own setting. Then we ask them to complete a template. And then we ask them to review the other students' template. And we've also planned for these 12 templates to get a little bit of asynchronous feedback from the tutor, which their students can then take to the next discussion in the morning or the afternoon and bring up any questions. So I hope that kind of explains how we worked. And then if we scroll along, maybe one more, Eric, just briefly. This is an example of a completed one. Where we, oh yes, sorry, keep an eye on my time. So here you can see, and I really recommend, it's a really creative, interesting process to go through. And all the little yellow and blue comment boxes are a really useful tool where people contribute their ideas for particular activities. And what happens is because we come together as a team, people have different perspectives. So I'm the instructional designer, I'm very focused on, how we engage and motivate the learners, but then the Daksha and the module organisers might be very focused on making sure there's no gaps in the understanding before we get to a learning activity, or where we might have resources already that we can reuse. So I think if you pull back, Eric, you'll see that we did one for all the 6 days of our 5 days plus assessment of the course. And what happens next is once we're all happy and we've reviewed it, we kind of move to a production sheet and we start to create the activities and content that we're going to produce. So that's a bit of a whiz-bang tour, but if we can go back, I've got one more slide to show you where we would like to talk about some of the strengths and maybe the limitations of our experience using this approach. So in summary, we're big fans. We find it incredibly useful for developing a shared understanding of the course amongst a team. As Daksha said, it's quite a disparate team. It's very flexible. You can go and you can change. It's very collaborative. It also helps make our pedagogy explicit and identify those content and learning gaps. It really makes those obvious. Which maybe would be harder with a Word document. And it's a useful reference for our course production. The little screen grab I've got there, we actually shared our design with the Central Learning Technology team, and they had a Zoom meeting which they recorded, and they fed back some really useful ideas and notes for us, both on the design and how we would implement it. So that was something we wouldn't have got previously if we hadn't had this shared approach. I'm not sure if I'm over time, but I just want to say we think there's a lot of scope for rolling this system out on a wider level, where we think, and if it's done at scale, you can start to improve efficiencies and even start to improve student outcomes by maintaining that quality and consistency across different module designs. Of course, there's limitations. Faculty do find them a bit complex. They do need guided through it. Miro needs to be paid for. There's no, as a production person, there's no automated link to production. And to roll it out more widely would need quite a lot more strategic thinking and change management. So I think that's me. We will continue to improve this. We find this a really useful tool. I'm going to pop the link into the announcements so that if you're interested to have a look yourself, you can do so. So thank you very much.
Thank you, Sally and Daksha. Excellent, very excited and very practical in the sense of how flexible it can be. I think what I found particularly interesting there was both that the process of design clearly demonstrates flexibility and the ability to move learning around and to focus in different ways, but also you did this under lockdown or under everybody kind of working from home, so presumably it itself is quite a flexible mode of working, provided there's access to digital opportunities.
Yeah, absolutely.
So very exciting. Thank you very much. I had a question for you both, and I also had a question for Matt, and I thought I'd use my questions to give the audience a bit of time to start to input their questions, if I may. So just to note, the slide I think shows on your screen how to input your questions into the Q&A, and we really do want this to be a discussion as much as possible given the constraints of the digital environment that we're in. But audience, please do feel free to comment, question, feedback, and perhaps even share some of your experiences in designing for flexibility and contingency. So Sally and Daksha, if I might ask you first, so have you launched the module yet or the program yet? And if so, what has the sort of student feedback been so far?
Shall I go, Sally? So Linda, what we've done is we tried and tested this method on our MOOCs, so we know that the methods work when we put these things together in that way. Our first module, we are in our first week at LSHTM, so the proof will come in 3 months' time whether this works. So yes, we'll keep a close eye on this and see which bits worked and which didn't. That is our intention.
Mm.
Thank you. Matt, if I might turn to you, I think it's been a fantastic contrast in this session because we've had Sally and Daksha talking very specifically about a particular program and illustrating a really in-depth way of designing there. And Matt, you were able to bring us a very wide view of your institution's fantastic innovation and creativity. I guess my question would be, Matt, kind of what was the bottom line? You did so much and such a creative approach to solving some of these problems. Has it been hugely expensive to mobilize all of this? I'm thinking about all of that plexiglass you mentioned.
Yeah, so that was one of our rate limiting steps. To do this, I think successfully, it has to be an ongoing partnership with our instructional design team, our faculty, and where I work, which is in administration, trying to find the resources to actually do this. And we applied and got 3 government grants to cover some of it. It covered less than 20% of the cost that we needed to do this. And then we also raised some money from private donors that were more focused on the medical school part of it, but were able to help us and help some students with some of it. Those ultrasound probes were quite expensive for some of that. And so, and then the rest of it, we just took from internal budgets and had to try to be very, very careful with the spending. But I think you are limited on, and we were quite limited by our imagination. The faculty actually found tools that were absolutely incredible. And we were able to provide those in smaller areas, some of our 3D anatomy stuff and some of our virtual reality things. But we found that we were not able to scale them to every program that would have wanted that technology, nor were we able to scale the training that was needed to operate some of this very highly technical stuff. So we keep working on it. It's a work in progress.
Yes, thanks, Matt. Yeah, I mean, it's interesting that there were some government grants to be applied for. I'm not sure that it's that we're in that situation in the UK at the moment, but it would be interesting to see. Thank you for that. We did have a question, Matt, if we could just get you to provide us again with the definition of high flex as opposed to hybrid, because that was, you know, people were very interested in that, I think.
Yeah, so that's the why that fits. So you can look back at the high flex definition from EDUCAUSE, which I thought was great. But for us, practically, hybrid is where we're going to provide in one course. Definitively, all students will have to do some online and some in-person instruction, and the amount of each is designed and picked by the professor. High flex means that there is an in-person teaching, but it also could be provided simultaneously online for learners who are not able to be on campus. So if a person was quarantined for 10 days, we needed to have the ability with the limitations of certain things. I mean, we're able to do certain of our health rotations for our medical students online through our very robust telehealth network, but certainly not a surgery rotation or a variety of other things that we were able to do. So it could be, this one could be provided both in person and simultaneously online to learners that had to be at home. And also it had to be highly flexible, both hybrid and flexible, because if we had an outbreak at our campus, as I don't know if you're following the literature, but there's been a lot of outbreaks in the United States at campuses. The city of Philadelphia told us very, very directly that they could close us down at any period of time. And then we knew within a day we would have to flex everything to online. So the hybrid flexible model allowed us to do this. And I'll be very honest with you, before March, I've heard, we were always ran 50 programs that were hybrid, but I had never heard of high flex until March. And our architecture school said, I think this works. And I said, I think it does. And that's where we came up with it. Not our idea, but it was great to find it.
Okay, thank you. We have a question from the audience that says, and I think this is open for all 3 of you to input if you might. When looking at flexible design, something that has come up is the idea of resilient pedagogy. What are your thoughts on this, and how can people build material that can be used in any context? I guess for Matt, this works well with the high flex model. But Sally and Daksha, you might also want to respond to that.
For us, Linda, I think we're on a very steep learning curve here. One of the biggest assumptions we've made within this process is we've got a very wide international group of students that are coming onto our courses, and they are we have absolutely no idea what their own digital skills are, what their own connections are like, or what kind of equipment they have. We've made very big assumptions here when we put the content up. And this is something I think, and Sally I think loses sleep over this a lot, because she goes to great lengths to try and provide accessibility and different ways for students so that they don't have to do things one way. So I think what we are going to closely monitor is what is our retention for the students because of connectivity and digital skills, and then also how do they flow through the pedagogy that we've created, or the stacking of the knowledge bits or the chunks that we've pulled together using the Miro system. How are they able to navigate themselves through that process? And I think that's what we've really got to watch out for from our side for the next 3 months.
Mm-hmm.
Sally, did you want to add to that?
Yeah, not to, yeah, that's a great answer from Daksha on that side. I think maybe something that occurred to me as a production person is the use of open copyright, maybe in encouraging longevity and resilience, particularly with bite-sized content. So, and we are talking to our faculty about whether they're interested in and feel comfortable to apply Creative Commons licenses, and then we talk them through that process. That's maybe, it's a small piece, but it's a piece.
Thanks, Sally. Actually, I think that picks up on a question that's just come in from Jason about how might you see adaptations of these approaches translate to teaching health personnel in low resource environments. And I think Matt picked up on this too. So for example, health workers elsewhere in the world and in larger numbers.
So we work with I think now 9 global partners, and not everyone has the bandwidth issue. There's a variety of different issues. So we have moved to a what we call in situ training, which is where we send training modules that will go with a person, with an instructor. It's sort of a train the trainer. You're giving them some equipment, and then they do it on site with the proper equipment and with the proper PPE. And sometimes, you know, if there are digital issues or learner issues or other issues, sometimes that's the best way to do it. Obviously, if for our surgical residents who need to have access to the robotic Da Vinci trainer, that cannot be shipped. And so there are some limitations to what can be done, but there is a lot that we found that could be done that wasn't as expensive as we thought it would be. And then we've worked with in situ training. We are working on a grant to get a mobile van that would do in situ simulation training to areas that were hard to get to in our area.
Yeah, very good. Sally and Daksha, coming back to your program, I noticed that your program was day by day, and it seemed that there was a very rich learning experience throughout that day. So that, I guess, poses challenges in terms of flexibility if the person turns out not to be actually able to engage on that particular day. Is that a problem, or is there a way of disaggregating the day from when the student actually does the engagement?
Go for it, Sally.
It is attention, Linda. So it's a requirement that we need to deliver in this way. So we're doing our best to make it as flexible as possible. So we record all the live engagements and provide them as recordings and as transcripts. We provide slides and text for all the videos. I think something that we will see in proof will be in the pudding when we start moving with the async, how able the students are to take part in the activities, whether we need to delay when we give the feedback. So I think that's something we haven't pinned down on purpose because we're not sure, hopefully, but I think it's a good question. Do you want to add to me, Daksha?
Well, it's quite a complex situation because we'll have somebody from the US who's working at 3 o'clock in the morning and another person in Hong Kong maybe at 10 o'clock at night. And in between, we've got all the different time zones. And running too many synchronous sessions, I think, is a disadvantage when you're trying to expect somebody to engage at various hours. So where possible, we've tried to limit synchronous sessions and kept it to a flexibility for them to navigate the content at their own pace through the day. But once a day, I think, an hour with the module organizer or with an expert perhaps is doable. And that's the formula that we've applied right now. And that session, even if they missed it, is recorded and then transcribed and made available. So we're hoping that we can plug all the gaps using a variety of techniques and not shortchange the student from a quality education.
Thanks, Daksha. I think that's an excellent sentence to end with, actually, because what we're seeing here and what I know of colleagues working across the globe, really, in higher education and of course pre-higher education, is that massive commitment to providing a quality experience for students in these extraordinary times. So I hope colleagues who've joined us on this webinar that this has helped to illustrate some of the approaches and the creativity and the opportunities that are available. Slides will be sent out and we will send you a link to the recording of the event. Eric, if you could just pop up the slide that says our next date and a little bit of detail about that. And we'll be talking about synchronous teaching, particularly looking at maths and science teaching. So here we've had a mixture of talking about synchronous teaching and asynchronous teaching and different approaches, but we'll particularly be looking at the challenges of teaching live sessions online in maths and science areas, and I think that will be of particular interest. And it's really very much about learning from the experiences and sharing that learning in a discussion with as many people as possible. So a huge thanks to my colleagues Matt, Daksha and Sally. Thank you very much, and thank you to Tim for hosting the event. And of course, thank you to the audience for joining us, and behind the scenes that a lot of people have been involved in setting up this event. So we'll be sending out some feedback evaluation forms if that would be helpful, and we'll also be giving the colleagues an opportunity to identify some subject areas that they would like in some of the events coming up. I think we've got time just for one last comment if anybody on the panel wanted to say anything finally.
Thank you, Linda. I think this is a very useful start to a very interesting session.
Thank you.
Okay.
Bye-bye.
Thank you. Thanks very much, everybody.